If you are a doctor or a healthcare provider tuning in, you know the sinking, heavy feeling of sitting in an exam room with a patient who is suffering from severe depression. You have probably watched them, perhaps a senior who has lived a vibrant life, sit there completely exhausted. You prescribe an SSRI, maybe an SNRI, and then another, but nothing lifts that heavy cloud, and the systemic side effects like weight gain, insomnia, and profound emotional blunting become unbearable. For decades, our hands have been tied by the limits of standard oral medications. We have relied on chemicals that flood the entire body just to reach a few specific circuits in the brain. But what if I told you that this year, the entire paradigm is shifting? What if your patients could safely treat their depression right from their living room armchair, using targeted electric medicine instead of another daily pill? Hello, I'm Dr. Stella Grace, your AI health speaker, and welcome to the Deep Dive with Stella. Today, we are exploring one of the most exciting medical breakthroughs of our time. We are talking about the FDA's recent clearance of advanced brain stimulation devices that are redefining how we treat major depressive disorder in 2026. For our older viewers, or anyone watching a loved one struggle, I want to guide you through exactly what this means, how it works, and whether it might be the right option for you. The depression epidemic and the need for change. Before we talk about the devices themselves, let's understand why this is so necessary right now. Millions of adults are currently fighting depression, and for my senior viewers, I know that you are often already managing a daily handful of pills for blood pressure, cholesterol, or joint pain. Adding a heavy antidepressant into that mix can cause difficult interactions and severe side effects. Many of my older patients simply stop taking their depression medication because the side effects make them feel worse than the depression itself. Have you or a loved one ever struggled with frustrating side effects from an antidepressant? Let me know your experience in the comments below. The shift to electric medicine. This brings us to the breakthrough, which is the shift from systemic chemical medicine to precision electric medicine. Instead of taking a pill that affects your heart, your stomach, and your metabolism, we can now use targeted electrical stimulation to wake up the exact part of the brain that is sleeping on the job. Historically, non-invasive brain stimulation was confined to specialized clinics. But technology has finally evolved, domesticating some of these treatments so they can be safely used in the comfort of your own home. Scientific research on the new brain stimulation device that's replacing antidepressants in 2026. Let's dive into the science behind the device making the biggest headlines right now, the Flow FL-100. The Flow device received pre-market approval from the FDA in December 2025 as a Class 3 medical device. How does it work? The Flow FL-100 uses a technology called Transcranial Direct Current Stimulation, or tDCS. You wear it like a simple headset. It delivers a very mild 2 milliamp electrical current to the left dorsolateral prefrontal cortex. This is the area of your brain situated roughly right behind your upper forehead, which often shows sluggish underactivity in patients with depression. The subtle electrical current helps depolarize the resting brain cells, making them more active and rebalancing neural activity to improve your mood. Let's look at the established clinical evidence. The FDA approval was heavily based on a rigorous, fully remote clinical trial known as the EMPOWER study. The trial evaluated 174 adult patients suffering from moderate to severe major depressive disorder. After 10 weeks of treatment, the patients using the active Flow device experienced a clinically meaningful reduction in their depression symptoms compared to a control group receiving a fake or sham stimulation. The results were remarkable. According to the study, 54.4% of the patients using the active device had a significant response, and 44.9% achieved full clinical remission from their depression. That means nearly half of the patients who use this device felt their depression practically disappear. We also have real-world data from its use in Europe, where among 55,000 users, 77% experienced symptom improvement within 3 weeks. Now, I always want to be perfectly transparent with you and clearly separate established evidence from preliminary findings. The established evidence proves that this device reduces depression symptoms significantly better than a placebo over a 10-week period. However, it is important to note that quality of life surveys in the trial didn't show massive immediate changes between the groups, suggesting that rebuilding your overall life and daily routines takes a little more time even after your mood begins to improve. The patient experience. A relatable example. Let's make this real. Imagine a 72-year-old grandmother. We will call her Margaret. Margaret has struggled with depression for 2 years following the loss of her husband. Her doctor prescribed an SSRI, but it made her dizzy, upset her stomach, and made her too tired to play with her grandchildren. Under the new guidelines, Margaret's doctor prescribes the Flow headset. Margaret sits in her favorite armchair, opens an app on her smartphone, places the headset over her forehead, and does her daily crossword puzzle. The treatment lasts exactly 30 minutes. During the first 3 weeks, she does this 5 times a week. For the next 7 weeks, she drops down to just 2 or 3 times a week. There are no stomach aches, no daytime grogginess, just a gradual lifting of the fog. High-velocity in-clinic neuromodulation. The SAINT system. While home-based headsets are incredible for moderate to severe depression, what about patients suffering from deeply treatment-resistant or severe depression? For those situations, we have another massive FDA-cleared breakthrough called the SAINT Neuromodulation System. SAINT is an in-clinic treatment that compresses 6 weeks of traditional brain stimulation into just 5 days. Instead of a headset, it uses targeted magnetic pulses. Using an advanced 8-minute MRI scan to map your brain's individual wiring, the SAINT algorithm finds the exact millimeter on your cortex that needs stimulation. Over 5 days, patients receive 10 3-minute treatment sessions a day, separated by 50-minute breaks. It is a highly accelerated, personalized therapy that is scaling nationwide to help those who need rapid relief the most. It is amazing how fast technology is moving. Are you more interested in an at-home headset or a fast 5-day clinical treatment? Tell me what you think in the comments. Managing expectations, safety, and side effects. Now, as a health educator, I want to make sure we avoid exaggerated medical claims. These devices are not magic wands. They require commitment, and like any medical treatment, they have side effects. The side effects of the at-home Flow device are generally mild and transient. In the clinical trials, there were absolutely no serious adverse events related to the device. The most common issues were skin redness, an itching or burning sensation on the forehead, and temporary headaches. But here is a very important safety warning. You must use the device correctly. In the trial, a couple of patients experienced mild first-degree skin burns on their foreheads. Do you know why? Because they tried to reuse dried-out electrode sponge pads. The pads must be properly moistened with saline to safely conduct the electricity. So, if you use this device, always use fresh, wet pads exactly as instructed. Cost and accessibility. You are probably wondering how you can access these treatments. The Flow device is expected to be available in the US by September 2026. Because it is designed for home use under remote clinical supervision, it offers a much more convenient and potentially accessible option compared to driving to a clinic every single day. You will work with your healthcare provider to get set up on the clinic's patient platform, which allows your doctor to monitor your progress and ensure you are using the device safely. Practical tips for seniors. If you are an older adult considering at-home brain stimulation, here are my top practical tips to help you succeed. Do not fear the technology. Yes, the Flow device requires a smartphone app to control the headset and track your progress. If you aren't comfortable with apps, ask a grandchild, a family member, or a friend to help you set it up the first time. The app is designed to guide you step by step. Prioritize your skincare. As we age, our skin naturally gets thinner and drier. Because the device can cause skin redness and dry skin, consider applying a gentle, doctor-approved moisturizer after your daily session. And remember our safety rule, never reuse dried-out electrode pads. To keep your doctor in the loop, you do not have to quit your current medication to try this. The FDA-approved the Flow FL-100 to be used as a standalone treatment or as an add-on to your current antidepressants. Keep taking your prescriptions and let your doctor guide your care. Key takeaways. Let's summarize the key takeaways from today's deep dive. First, 2026 is bringing a revolution in electric medicine, allowing patients to treat depression at home using targeted brain stimulation devices like the Flow FL-100. Second, scientific evidence proves these devices are highly effective, with clinical trials showing remission rates of around 45% for at-home use, and incredibly fast, personalized results for in-clinic treatments like the 5-day SAINT protocol. Third, they provide a safe alternative or addition to traditional antidepressants, bypassing the harsh systemic side effects that many older adults struggle with. And finally, while the side effects are minimal, proper device hygiene like using fresh, wet electrode pads is non-negotiable for your safety. Depression can feel like a life sentence, especially when you feel like you have exhausted every pill in the pharmacy. But science is moving forward. We are entering an era where we can gently, safely, and effectively coax the brain back to health, giving millions of people, especially our seniors, their joy and their lives back. There is always hope, and today that hope looks brighter than ever. If you found this video helpful, please subscribe to the channel and turn on the notification bell so you never miss our latest health and wellness content. And I'd love to hear from you. What health topic would you like us to cover next? Let us know in the comments below. Thank you for watching, and I'm Dr. Stella Grace. I'll see you in the next video.